Hello, good afternoon. My name is Ovidiu Baltatu, and we are here with my team, happy to present to you our project on impact of burnout on cardiovascular and immune biomarkers among frontline healthcare professionals during COVID-19 pandemic. It is a privilege to share leadership with a highly skilled physician scientist, the brave heart Dr. Hashel Al-Tunaiji, and a key opinion leader, distinguished Dr. Wael Al-Maknel. We are privileged as well to have our project acknowledged by Professor Detlef Ganten, the president of the World Health Summit, who was so kind to send us a statement for our study. Please allow me to read the statement. Healthcare professionals are passing through unprecedented challenges with the COVID-19 pandemic in many aspects. They are risking their own health and lives, threatened not only by exposure to the coronavirus, but also by an ever-increasing stress at the workplace that amounts to parallel the pandemic itself. The increased exposure to workplace stress has been associated with deleterious consequences on mental health, with higher rates of anxiety disorders and an increased cardiovascular risk. Identifying at an early stage the healthcare professionals' burnout and associated comorbidities is becoming most important to healthcare policymakers for developing preventive strategies to reduce or prevent burnout, cardiovascular risk, and associated diseases. We have to take care for those who care for us, said Professor Detlef Ganten. The academic team of our project is from Khalifa University, and I'm very pleased to have today join me Eman, Lujain, and Namdi. And we have also from the Abu Dhabi University, Luciana and Wasim.
We are very privileged and blessed to have our collaborators from Zayed Military Hospital, a team of highly skilled medical doctors and residents. They are the recruiting team who will help in approaching the healthcare professionals at different hospitals. The hospital sites team are of strategic help to open for us the doors to 4 major hospitals in Abu Dhabi, including Cleveland Clinic Abu Dhabi, Sheikh Shakhbout Medical City, Sheikh Khalifa Medical City, and finally Mediclinic. As you know, the coronavirus 2019 pandemic has created new and unpredictable challenges for healthcare systems. This widespread outbreak has been associated with psychological distress and symptoms of mental illness among the healthcare workers who are the frontline warriors dealing with the patients infected with coronavirus. So in our study, we wanted to investigate the evolution of psychosocial, cardiovascular, and immune markers in healthcare professionals with different levels of exposure to the COVID-19 pandemic. We specifically wanted to study an association of burnout with cardiovascular risk. We also wanted to investigate the effect of healthcare professional category and years of experience on the possible level of association between burnout with cardiovascular and immune biomarkers. We would like to express our gratitude to Khalifa University and Department of Health in Abu Dhabi for granting us the Institutional Review Board approval at the national level. Our study is observational, cohort, prospective, where we have a blended exploratory study involving both online and on-site approach with wearable monitoring.
We have a well-structured, multi-step design where we have 5 steps. In step 1, we have the online recruitment, which will facilitate step 2, where we have the on-site visit. Step 3 is where we have the follow-up, which will be done at 2 time points, at 3 months and at 6 months. In step 4 and 5, we will analyze and publish our data, which will focus on the primary outcome of the study. That will focus on the burnout, the cardiovascular biomarkers, and the immune biomarkers. Let me give you some more details about the steps. In step 1, we will be collecting data, basically the socio-demographic characteristics, the Masdar, burnout inventory, and the Foster B-Watt score, where we will focus on 5 modifiable risk factors, which are the blood pressure, exercise, weight, alimentation, and tobacco use. During step 1, also participants will be invited to join step 2. They will also sign a consent form, e-consent form, and they will provide their contact details for step 2, where we will be testing heart rate variability via 2 ways. The first way is via camera heart rate variability application installed on the investigator's smartphone. And the second one is via smart polar watch, where these participants will have and will wear for the duration of the study. In step 2, we will calculate or we will collect data about the physical activity of participants, their screen time via their smartphones. We will also be collecting samples, blood samples, to measure C-reactive protein, CBC, cortisol, among other cardiovascular and immune biomarkers. And step 2 will be repeated at 2 time points, at 3 months and at 6 months, before we start analyzing our data.
We are fully complying to the Health Insurance and Portability Act, which set the standard for securing sensitive health data. Our data management is divided into 3 phases: the data collection, the data handling and linkage, and the data visualization. For our data collection, we are using Internet of Things polar watches, which will be distributed among the participants to collect their data remotely. We did this to ensure that the social distancing norm caused by the pandemic is still maintained while collecting the data. For the data handling and linkage, the outcome measures will be read, transformed, and consolidated. The results will be mainly presented as a median for continuous data and as a frequency percentage for categorical variables. Finally, we will inject this data into a Power BI software for the data visualization. So, the end users are going to see the visualization clearly and simple, as you can see from the dashboard.
In this slide, you can see our flyer inviting to participate in this meeting, and please feel free to send me a message if you would like to receive this flyer. And at the end, please allow me to acknowledge the management, regulatory and sponsorship we received from the university. So we gratefully acknowledge the help and support of Kia Manager, Research Compliance and Training, Blake, Acting Director, University Sponsored Research, John Radowski, Director of Research Services, and Stephen, Senior Vice President for Research and Development. I thank you, and we are happy to receive any questions you would like to give us. Thank you. number of 350 participants to the study. In respect of what health problems they are facing since the pandemic starts, in this study we are focusing simply at the psychological problems and with possible effects on the cardiovascular risk. Regarding the data analysis, indeed we have ad interim analysis, and in the situation when we will observe pathological alterations. We will announce the study participant in order to take the appropriate measures. It looks like the sound is not working. It's working? Okay. So in respect of joining Khalifa University, I strongly encourage you to join Khalifa University. We at the College of Medicine and Health Sciences, we are an enthusiastic team in order to provide you the best education and training to become a medical doctor. So feel welcome to contact me through the email I sent to you, and I will forward your questions regarding admissions to the medical school to the appropriate persons in order to answer your questions and doubts. I just placed my email in the forum, so feel free to send me your comments and your questions directly to my email. You're very welcome.